Challenge there. Let's go now to Dr. James Smith. He's an emergency medicine doctor. He worked in Gaza's hospitals during the war, and he now joins us from London. Good to have you with us. I'm sure you're following what's happening at the Nasser Hospital. How worrying is it to you, as somebody who's worked in Gaza hospitals, that a hospital can be shelled, it can be stormed, the medical staff treating patients rounded up because a warring party claims it suspects bodies of captives might be at this hospital?
I mean, this is another catastrophic example of another egregious attack on a healthcare facility in Gaza. In the last 3-4 months alone, more than 400 attacks on healthcare across Gaza, almost the same number again in occupied West Bank. What's happening now in Nasser Hospital is symbolic of, or representative rather, of a complete neglect of the most basic rules that that guide conduct in times of armed conflict. As you've mentioned and as we've heard, we're hearing stories of patients that have been killed in their hospital beds, artillery fired directly into the hospital, patients that have been killed because the electricity has been cut from the hospital, others who've been forced to flee, but then fearing for their safety, having to pass through Israeli military screening, have returned to the hospital. It's really yet another example of the most catastrophic neglect of the Palestinian people.
All right, there was a statement, and let's see if we can bring it up, that came out of Médecins Sans Frontières, in which they were talking about, let's see if we got the script. All right, so what they were talking about is that the Nasser Hospital in Khan Yunis in Gaza was shelled in the early hours of this morning, despite Israeli forces having told medical staff and patients that basically they should go back and stay in the hospital. Are we reaching new lows? It's hard to understand how something like that can happen.
I should be really clear here. I mean, I think those new lows have already been reached. Over the course of the last couple of months, we have reached those new lows and we have stayed there. And what we're seeing now is a global either neglect or inability to do anything about what the Israeli military is doing in Gaza currently. These latest examples from Nasser Hospital are beyond tragic. They fill you with sadness and rage. But they are yet another example of exactly the kind of things that we've seen in Al-Shifa some months ago and in several other healthcare facilities across the Gaza Strip.
Is there some obligation upon the world powers now to intervene, basically? Are we seeing a failure that's on a much higher level than just the warring party?
Absolutely. There certainly are very, very clear obligations. They existed prior to the International Court of Justice ruling, but they are certainly made even clearer now on the back of the ICJ ruling. The ICJ has imposed provisional measures saying that there are very plausible concerns that Israel is committing genocide against the Palestinian people. There is no allegation more grave than that of genocide. That places immediate moral, political and legal obligations upon all world powers, particularly those who up until this moment have continued to finance and to provide political and diplomatic support to the Israeli state. And by this we mean, of course, foremost among those states, the United States, the UK and several other influential European and North American governments.
All right, good to have you with us. Thank you very much for your perspective.